Welcome to today's Insider Session, Achieving Efficiency in Health Claims Processing. I'm Mark Miller, Senior Vice President of Insurance for Naviant, and with me today is Travis Spangler, Vice President of Innovation. So let's jump right in. You've been processing claims and other documents for a few years now, and your data entry is complex and it's got to be correct. Knowing how to handle all of the business rules for the capture of CMS 1500s, UB04s, and ADA documents are fraught with all kinds of problems. And the bottom line is that this process is complex and really still manual. So with those manual resources handling those documents, your costs keep going up and up and up, and it's getting harder to keep up with your demand. So don't worry, you're not alone. There's lots of folks that are in the same boat with you, but again, you still have a problem. So now you've been charged with figuring out a way to lower your costs, but you're not sure really where you should start. You've been asking your staff to do more with less. That's so 2020, right? Well, and it's getting harder and harder to keep that team together that's manually keying the information. So there's lots of churn. You end up paying overtime just to keep up with the demand you've got. Our experience working with hundreds of organizations tell us that those organizations like yours adopt changes in the organization for three primary reasons. And those whys that we call them are really, they want to increase efficiency, they want to grow their organization, or they want to lower their risk. So your why might be one or really a combination of all of these whys. And then oftentimes we look to the latest kind of shiny technology to solve our problems. But we know from our experience that change management is more important than the technology itself. Without it, you'll have a tougher hill to climb. When it's tied to the why that you've identified before, that message is important and comes from your leadership. And that message needs to be frequent and consistent. You can't just tell the story of why once and expect everyone to remember it. There needs to be a regular cadence and reminder of why changes are needed throughout the organization. In most cases, the why story needs to be told hundreds of times in group settings, maybe during your one-on-ones, and anytime you get the opportunity to remind organizations why this is important. Our clients that employ a strong change management process report a higher than average adoption and better long-term success when it comes to adoption of change and digital transformation. So, we talk with hundreds of organizations, and here's some of the things that we're hearing in the market. I'm guessing at least one of these statements sounds familiar to you. We're entering data, the same data into multiple systems. We hear that very, very commonly. Maybe like you, they've implemented a legacy OCR technology 10 years ago, but it can't necessarily keep up with the changing landscape, and it's creating more problems than it solves. Maybe you've outsourced your data entry, but the data's coming back. It's just so bad that it'd be better if you found a way to bring it back in-house and manage that. Or in a number of cases, we're hearing that the outsourced supplier really isn't providing that service anymore. According to a recent report from the Healthcare Payment and Revenue Integrity Congress, payers are prioritizing these investments in AI and machine learning more than investments in any other data technologies right now. In fact, 42% of payers say that investment in updated tech and AI is their primary and top focus. But again, you're asking yourself, well, where do I get started? Travis?
Well, Mark, thanks so much for the handoff. And folks, it's really good to be with you today. And I just wanted to share that for 35 years, Naviant has been in the business of confronting challenges alongside our customers. Now, we realize that it's not just the challenges, it's not just technology. There's people, there's processes, there's time, there's complications, there's rules, there's compliance. There's just a lot of things that go into modernizing kind of where we want to be as an organization. And that's why Naviant is taking on this idea of being your trusted advisor. This is a key phrase for us, especially this year. We're going to start telling our clients more and more that we want to be alongside you. We don't believe in throwing technologies or even ideas over the fence. We want to work on solutions alongside of you. So that takes us then over to our approach. How do we do these sort of things with you? And as you can see on the screen, we put a lot of thought in the way that we manage this change process, this change management that Mark was talking about just a few slides ago. And our approach is really two different phases. We have a planning phase and we have an implementation phase. And these are meant to be very iterative. So we want to work alongside you. We once again want to be your trusted partner being key, not a dictator. We want to be a partner. We don't want to tell you what technology is going to do for you. We want to make it work for you. And you can see that's done here by just having a really cool feedback loop through what we call our planning phase. It starts with initiation. We end up providing a planning report that you and your team can then study, review. We can provide feedback. We can make adjustments to that report. And then when we all agree, most importantly, you agree that this change is ready, we will perform the implementation. And once again, this is a very, very customer in the loop centric implementation. We want to make sure you know where we're going as we implement new ideas, new technologies alongside you. So anything from on the bottom step there, from step 1 to step 7, is really including you in that feedback. Once again, being your trusted advisor throughout the process. So Mark, if you don't mind, let's shift gears over to our health claims process. Now, this is a process that we've seen quite a bit of growth in over the last couple of years, actually. And it's a really cool use case for us as far as a technology provider, as a partner for you, because Naviant has technology that can automate your health claims automation. So as documents come in, you can see working from the left to the right here. As documents come in, a variety of different channels. Sometimes we may get claims from a fax line, or we may get paper. They may come in through email. So as documents come in, we have technology that's going to perform kind of what's typically known as OCR. But this OCR technology has gotten quite impressive over the last several years, using concepts like machine learning and AI. So although the terminology is kind of boring and old school, I can tell you that it's very awesome in the works, because the step number 2 is really where the power of this AI machine learning kicks in, where the software has the ability to classify the health claim forms. By the way, we support all top 3 formats. So your CMS 1500s, your UB04s, your ADA forms. So we know as part of the software looking at a document, it knows automatically what that document type is. It's not something you have to pre-prep or put in a special envelope or use a barcode to stamp on it. The software will automatically be able to look at the document and say, I know what claim form this is. And so once it does know, we move to step number 3 on the diagram, which is the extraction. So Naviant has pre-built models to extract data from each of these health claim forms, and we essentially extract every field off of them. It's not something that you have to come into the software and start training it on, because we've already done that work for you. We typically like to say we're 80% of the way through the process. The rest of the 20% really comes down to what we call the validations. What are the business rules that we need to apply? Does your organization have SNP level expectations as far as validations go? Are there any data lookups that we want to perform? So step 3 is more about not just data extraction, but what business rules make a document legitimate to be processed in your organization. Our goal then, of course, is always step number 4. We want to do straight through processing when and how we can, and if applicable. So the idea here is, as a document comes in, we don't need a human to review the content that we've extracted off of it, only in certain conditions where the validations that I just spoke about are violated. So when there's a business rule violation, we can route that to a human in the loop. You'll actually see this in a few different slides coming up. And the human in the loop can then make decisions from a business perspective on how to handle that document. Once that's done, if we don't need a human at all, we have the ability to then produce the data and the document in a variety of formats that help ease the business transition to the next downstream process. Sometimes that's, for example, claims adjudication. So one of the things that we do is we have an option of exporting these health claims to an 837 format. That's EDI 837. And that's a very common format used for these health claims. It's already pre-mapped. It's already something Naviant has built and ready for you. Or if you don't use 837s, we can, of course, export the data into common popular flat file formats. So very cool different options. And the goal here then, of course, is on step number 5, get that data that we've extracted, get the document that we've used for extraction down to your next step of the business process for health claims. So when we think about the Health Claims Accelerator, we do support all 3 common form types from professional, institutional, and dental. You can see them on the form or on the slide here. And the reason I included them on the slide this way is because if you might be able to see, there's a light blue tint behind the fields here. And essentially what I want to tell you is that we already have technology that is ready to read these documents. So that's kind of the idea of these little blue zones, is that the software already knows where this information is. And by the way, we're using very current technology methods on this. So we're not using like old school OCR or old school zonal OCR. We're using machine learning concepts to classify and extract the data from these documents. So as a document comes in, thinking to our next slide here, as a document comes in, the software will perform classification and extraction. So the software, for example, on the screen knows that this is a CMS 1500. There's a ton of fields on a CMS 1500. That's kind of what you see towards the right of the screen here. And we already have every single one of those fields pre-mapped using machine learning technology. So you don't have to teach the software anything. We've already done that for you. The beauty of the technology as well is that we have some pre-built validations that are performed as the software reads this document. You can kind of see that towards the bottom right of that screen there. And the software comes with a ton of these different validations that you can turn off or turn on, but also you can customize these. So as you're processing documents, or as you're thinking through, hey, in our business, what is legitimate for our business? Then Naviant, as your trusted partner, your trusted advisor here, has the ability to work with you to implement your custom business logic. You don't have to stick with what we're doing here. We're just trying to give you an elevated or accelerated way to implement the technology with some of those business rules. But this is a great interface. The human in the loop will then use this to validate the data. Behind the scenes, we will produce the EDI 837. Now, this is an option. It is not a requirement. Some of our organizations don't want to produce the 837 because they have their own logic. But for our friends that need an 837, we absolutely have the ability to take the data we've extracted off that form and produce an 837, similar but typically more advanced than what you see on the screen. Cool. I want to share with you a very cool case study that we did for a client. And this client is implementing it in a claims processing sort of solution. This client is based out of the Midwest. They're covering 34 different states. They're just a huge employer. As you can imagine, that comes with a lot of documents, a lot of incoming information. The priority for us going into this implementation was, how do we implement an AI-based capture solution that focuses on process, people, and technology? And after meeting with the team there with this client, we decided that ABBYY Vantage was our key to doing that. So this was a really cool use case in the claims world. I'll actually show you here on the next couple of slides where we ended up going as far as a solution approach. So we had about 2.5 million pages per year coming in to the solution. I've talked a lot about claims in the last few slides, but by the way, our technology is extremely advanced. We don't have to only focus on claims. And in fact, you'll see that here is that there are a variety of document types that either were part of the claims process or supplemental to the claims process. So it could be a correspondence, an invoice, etc. But as those documents come in, sometimes if there's a barcode on them, we will use that just as intelligence of determining the document types and related data. But in other cases where there's not a barcode, we're not spoiled enough to have a barcode, we actually have to use advanced machine learning concepts to classify the document. Then from there, we'll extract a variety of data, up to typically 16 fields for this specific case study. That's kind of the secret sauce. The rest of it comes down to, how do we take care of the data and make sure that it's a legitimate business document? And I called that validation in my previous slides. And that's exactly what we're talking about here as far as lookups. There's a variety of lookups. You can see them here that we did as far as NPI lookups, or maybe certain condition codes, diagnosis codes, etc. So what information, now that we've extracted off the document, do I want to use to validate and make sure that what we're reading is correct? In certain cases, we then determine if there's a human in the loop. Once again, that's not a requirement, but there is reasons. Maybe if one of those lookups fails or there's a validation rule that fails, we want to route that to human in the loop. We would, in this case, we'd then convert it to JSON. That's one of our out-of-the-box options. So if you remember, I mentioned that we can convert to 837 in the health claims world, but we can also then convert to other file formats. So in this case, we did JSON. And then, of course, it gets ingested into their homegrown policy administration application. So a really cool use case here that we put together for this client. So the value of the solution, when we think about what did they get out of this? Why did they even want to do this project? Well, a couple of reasons, and actually Mark hinted at these a few different slides ago, is they had a legacy solution. It's aging. We got to figure out a way that we can implement newer technology, get an improved rate, but also get rid of some of that legacy technology. So we wanted a higher performance with our artificial intelligence or machine learning technologies. All of that said, so that we could grow business, or the client could grow business without adding headcount, without having to make it a really routine, monotonous process of adding additional document types or validating document types. So their why is in the legacy replacement, utilizing newer technology, and then, of course, as we all think about business, this is how do we grow and how do we reduce our costs? Mark, why don't you share about where they're going next and then bring us home here?
Yeah, you bet. So I think the next couple of areas that they've quickly identified is that first report of injury is a big manual process that they've got in place now. So they've got multiple resources taking a look at these reports, as well as the summarization of medical records. They're estimating hundreds of hours of weekly manual work that is taking place. So these are obviously ripe for automation and process improvement and where we expect to go. So back to you now, back to the viewer here. Where do you begin? That's your original question, right? Where do I start? Well, reach out to us today and coordinate that collaborative session so that we can understand your goals, address your business concerns, and guide you through that digital transformation process. We've helped more than 500 customers globally tackle process improvement for nearly 4 decades now. And through our consultative approach, we can help you build that blueprint to drive the message for change management and the value proposition across your organization. Once we've got that process and people kind of put together, we'll then bring in the right mix of automation technology and managed services to support that plan so you can really focus on the most important part, your core business, and driving growth within that business. So I continue to challenge and ask, what's your why? As I mentioned before, it's one or a combination of these areas, these 3 areas. You're looking to increase efficiency. In the case of claims, the faster you process a claim, the higher your customer satisfaction scores will continue to be. Are you looking to grow your organization? As Travis mentioned, we're all looking to do that, but the volume of claims that are coming in now seem to be increasing all the time. So how can we handle that increasing load without necessarily adding headcount? Or in the case of some of our other customers, do you feel like you need to really lower your risk, right? Insurance is all about risk, and you need to stay on top of that claims volume and the timing for responding to those just to make sure you're maintaining compliance. There's no wrong answer here, but identifying and communicating these whys are the foundation for the changes that you need to make moving forward. So remember, let's collaborate on a review of your people and processes first so we can best determine your blueprint for best practices. And then after that, we'll bring technology that supports that blueprint that we've worked on and collaborated together. I hope you found this interesting today. Travis and I would certainly love to have a conversation with you. So I would encourage you to reach out to us today to learn a little bit more and start the process on your own journey. Thank you so much.
Thank you all.